Ladies and gentlemen, esteemed guests, good afternoon and welcome to the launch event of the Cli-Health program organized by the Global Health Institute at the American University of Beirut. My name is Nadine Sabra, Program Manager at the Global Health Institute, and I'm honored to be your Master of Ceremony for this event. We'll begin with opening remarks from Dr. Fadlu Khouri, President of the American University of Beirut, through this recorded video.
Climate change or global warming is affecting more and more people worldwide. It is especially impacting people in areas where there are tremendous disparities of resources and an increase in natural disasters. This is particularly true of the Middle East and North Africa region, where challenges with policy, healthcare delivery, and resources mean that natural disasters actually impact many things, including the delivery of healthcare. Dealing with climate change and studying it from a research perspective are intertwined, particularly focusing on how climate change impacts the availability and delivery of healthcare. And we know that in the MENA region, broad disparities exist in this area. It's not sufficient to just study it from a research perspective, but also to look at that in the context of policy, resources, gender, social justice, and disparities. The Global Health Institute has been working for years to leverage a broad number of contacts in the academic, governmental, and NGO communities to make an impact in this area. That's why today we're launching the Cli-Health program at the Global Health Institute of the American University of Beirut. GHI is positioning itself to take a leading role in not only the study of the impact of climate change on healthcare, but on the critical nexus between these two. A critical focus here will be the nexus between climate change, healthcare availability and delivery, social justice, gender, and disparities. These are all interrelated with how mankind will increasingly have to adapt given the growing challenge of climate change and global warming.
We will now move to hear from Dr. Shadi Saleh, the founding director of the Global Health Institute at the American University of Beirut.
Hello, everyone, and this is not a recorded version. This is the live version. So, hello, everyone. It's a pleasure to have all of you with us. This is indeed a bittersweet moment. It's bitter because our country, Lebanon, is going through a rather difficult time with the conflict that we're going through, with the war in Lebanon that's happening now. And we at the Global Health Institute have been accompanying that war, supporting the efforts of the healthcare system in Lebanon, making our voice heard across our platforms, across different global health forums that we are part of. However, one thing that we are committed to and continue to strive for is always moving forward. This is a pivotal moment in the path forward of the Global Health Institute in terms of starting and launching, be it a soft launch of a new program on climate change, health status, and social justice. That nexus of those three concepts is quite dear to my heart, as it is to many of you, because the world that we live in, the intricacies of the global health challenges cannot be summarized in one aspect. So in any global health challenge that we are currently facing, there are different aspects and different areas that intersect and affect on it and affect it. So that is why it is our absolute pleasure at the Global Health Institute to be launching this program now and proving to you, our colleagues, our partners, our families, that even with anything that we are going with as a country and as an institution will continue to move forward. Let me just finish up by thanking our great partners, both within our institution and outside of our institution. Within our institution, we have great partners who are the Asfari Institute, who is represented by its director, Lina Abu Habib, our colleague, our friend, our compatriot when it comes to key initiatives, and also the Isam Faris Institute for Public Affairs, International Affairs and Public Policy, represented by our dear friend and colleague, Mrs. Yara Murad, the Associate Director, and also our regional partners, Dr. Kenza, our partners in Jordan and Iraq and in Egypt. And a very, very big special thank you to our external partners. We don't call them funders because they are basically our partners, the IDRC International Development Research Council of Canada and the Ford Foundation, the regional office that we will hear from both shortly. So I want to thank you again on joining us for the launch of this very important program. And we look forward to working with all of you on impactful initiatives and projects within that program. Thank you. Back to you, Nadine.
Thank you, Dr. Saleh. Our keynote speakers for today are Mrs. Saba Al-Mubaslat, Director of the Middle East and North Africa Office of Ford Foundation, and Dr. Muntasir Kamal, Director of Global Health at the Canadian International Development Research Center. It's noteworthy to mention that Ford Foundation and the IDRC, which is the International Development Research Center, are the partners and funders of the newly launched Cli-Health program. We will now hear from them through these two following videos.
Climate change is more of a concern to the MENA region now more than ever before. Given how it affects the life of people and their health, the health facilities, I think it is about time that we talk about it seriously because it cannot be ignored anymore. Unfortunately, it devastates those who their lives are most devastated, and those happen to be the marginalized population of our society. Climate change not only affects human health, but also, as I said, the operations and functions of healthcare facilities and health systems, especially at times of disasters and climate change related upheaval. It is really important to address it head on. Climate change and human health cannot be examined in silo. A nexus connect both of them together. They include, but are not limited to, justice, gender, and equity. Critical concepts that need to be factored into our programming as we talk about climate change and health in general. It is never enough to explore such an axis at the research level only. Policy remains a key aspect that plays a pivotal role in translating those studies and research into action and practice. Community mobilization and engagement are of equal importance as well. The Global Health Institute at the American University of Beirut is strategically positioned to examine the nexus of climate change and health, while also addressing key concepts like gender, social justice, and policy. The Institute has been working over the past years to establish a great network of local, national, and regional partnerships that it can certainly leverage to ensure the success of the flagship program it is about to launch. That program, the Cli-Health program, as called by our colleagues at GHI, is definitely something that we're very proud to be part of. We at the Ford Foundation have been working very closely with the Global Health Institute for quite some time now. Together, we embarked on a journey that we called, which was focused mainly on establishing a solid foundation of subject matter experts across the region, the MENA region. We believe that only with a partner like JHI, who think comprehensively and holistically, a project lead to a program and both become sustainable and impactful regionally, and hopefully beyond. To JHI, there's no better partner to embark on this journey with but you. We wish you all the best of luck. I think together we will go to new places. Best of luck to all.
Good day, everyone. My name is Montasser Kamal. I'm the Director of the Global Health Division at the International Development Research Center in Canada, IDRC. I'm here to celebrate our new collaboration with the Global Health Institute on building resilience to climate change across communities and health systems in the Middle East, North Africa. The impact of climate change on health is multifaceted, exacerbating existing health system challenges and introducing new community and individual level health risks among communities in the region. Women and girls and marginalized communities are disproportionately affected by the health impacts of climate change due to a combination of social, economic, and cultural factors. Despite the complexity of the impact of climate change on health in the Middle East and North Africa, evidence remains limited on the impact of policies and mechanisms adopted by health systems, health facilities, and communities to adapt and address these challenges. And because regional research is so limited in this area, the opportunities for comparisons and cross-learning are so hard to come by. The gap in this knowledge is attributed to both the lack of a comprehensive approach to assessments and research and evidence generation in this area, but also the absence of contextualized tools to perform such assessments at certain levels in the health systems and communities. Collectively, these gaps limit the ability of relevant stakeholders in the Middle East and North Africa region to effectively plan and implement tailored interventions to improving the resilience of health systems and health-related repercussions of climate change. This project aims to conduct a comprehensive assessment of the capacity of health systems and the effect of policies and procedures adopted by healthcare organizations and communities in Lebanon, Morocco, and Egypt to mitigate, respond to, and recover from climate-induced health impacts. The project also aims to understand how gender, contextual, and other social determinants influence the impacts of climate change on health, particularly among women and vulnerable communities. The Global Health Institute's multidisciplinary approach and collaboration will be well suited for leading a co-creation process and engagement throughout the research process of policy, health system stakeholders, and communities to develop research tools and interventions. It's this multi-sectoral and multidisciplinary approach that needs to be at the heart of the response to climate change and health, and to do this on a regional basis. We thank you all for being here today, and we congratulate the Global Health Institute on this new collaboration, and we look forward to our continued collaboration. Thank you and good day.
We'll now move to a presentation about the Cli-Health program with Mrs. Zainab Awad, manager of the program, who will delve into the program details and flagship initiatives.
Thank you, Nadine. Can I please share my screen? It's my honor for me today to be presenting to you the details of the Cli-Health program, Climate Change, Health, and Social Justice. Let's start by exploring together why GHI and partners Are you able to see my full screen mode?
No, Zainab.
Just give me 1 second, please. Can you do now?
Yes.
Okay. So let's start together by exploring why GHI and partners are focusing on climate change and health. Climate change is impacting the health systems of communities in a myriad of ways. It is associated with increased disease burden, whether infectious diseases or non-communicable ailments. It is causing forced displacement and migration, particularly associated with floods and droughts. Climate change is also affecting agricultural activity and food production, which is leading to increased risk of food insecurity and malnutrition, particularly among children. At the same time, climate change is overburdening our healthcare facilities and health infrastructures, while disproportionately affecting the most marginalized and disadvantaged communities. We always hear about, we always hear a lot about how climate change affects men and women differently. So how are climate change and health related to gender, equity, and social justice? Basically, the gendered impact of climate change reveals significant disparities in how different genders experience climatic changes. Women, particularly in developing regions, often bear the brunt of climate-related challenges due to existing social, economic, and cultural inequities. They may have limited access to resources, decision-making processes, and education, which exacerbates their vulnerability to climatic crisis, increases their exposure to gender-based violence, and jeopardizes their access to reproductive rights. As for social justice, it is fundamentally intertwined with climate health inequities, especially that marginalized communities, as we mentioned, face disproportionate impacts from climate change. These communities often experience higher rates of pollution, limited access to healthcare, substantial climate-induced displacement and migration, and inadequate resources and support systems to adapt and recover from climatic events. Before we move into introducing our pioneering program, let's have a look about the portfolio of the Global Health Institute at the American University of Beirut. AUB's GHI was established in 2017 in response to the emerging health needs of the Global South. It is the first such institute in the MENA region and among the very few in the Global South. At GHI, our mission is to address global health challenges with a focus on context and sustainable impact by that are not only sustainable, but also proportionally dependent on local and regional capacity. Within GHI, we operate in 3 main divisions. The first is our programs division, which is our research and policy arm, hosting 5 main programs: the conflict medicine program, the ISAHA program, the refugee health program, the epidemic and pandemic preparedness program, and our most recent pioneering program, Cli-Health program. Our second division is the academy, which is the capacity building arm of the institute, where it has multiple deliverables that aims to build the capacity of health professionals in the region and beyond. All of our offerings are available through our online global health learning and development platform, GLAD. And our third division is the ASSIST, which is the community services and support arm, with its flagship initiative, the Non-Governmental Organizations Initiative, NGOI. Moving back to our pioneering program, the Cli-Health program aims to explore the nexus of climate change, health, and social justice, as previously mentioned by Dr. Fadlu and Dr. Saleh, with a focus on vulnerable communities in the MENA region. Our program focuses mainly on understanding the impact of climate change on health at multiple levels and evaluates strategies that strengthen climate resilience of communities, healthcare organizations, and health systems. The main objectives of our program are basically improving climate resilience of health systems and health professionals, supporting evidence-based policy and practice, generating and translating knowledge locally and regionally, as well as applying a gender equity lens. We have 3 main flagship projects within the program currently: the climate resilience of healthcare facilities, health impacts of climate change on vulnerable communities, and capacity building on climate change and health. As a reminder, and as Nadine mentioned previously, our pioneering program, the Cli-Health program, is funded by the Ford Foundation and the Canadian IDRC in collaboration with the Isam Faris Institute for Public Policy and International Affairs and the Asfari Institute for Civil Society and Citizenship. Our program co-directors, who you will also shortly meet in the panel discussion, are Dr. Mirna Doumet, who's our health systems expert, Dr. Kenza Khomsi, who's our climate expert, Ms. Lina Abu Habib, who's our gender expert, and Ms. Yara Murad, who's our policy expert. Thank you so much for your attention, and over to you, Nadine.
Thank you, Zaina, for this presentation. We will now move to our interesting panel discussion focused on climate change and health in MENA, bridging equity, social justice, and policy for a resilient future, co-moderated by Mrs. Noor Al-Arnaout, Associate Director at the Global Health Institute of the American University of Beirut, and Dr. Mirna Doumet, Professor at the American University of Beirut, Hariri School of Nursing, who also serves as the co-director of the Cli-Health program. Dr. Doumet, since 1990, she assumed several academic and administrative positions. From 2011 to 2022, she occupied the position of Founding Assistant Dean at the LAU Al-Islam Al-Shaghouri School of Nursing. As President of the Order of Nurses in Lebanon from 2018 to 2021, under the most difficult circumstances, she was able to make the Order of Nurses play a major role on a national level. As a president of the Arab Nurses and Midwives at the Arab Board, Dr. Mirna is working with colleagues from different Arab countries on advancing the profession of nursing at the regional level. Mrs. Arnaout and Dr. Doumet, welcome to the panel. I would also like to introduce you to our esteemed panelists and experts. Dr. Kenza Khomsi, expert in climate science, Ms. Lina Abu Habib, expert in gender and social justice, Ms. Yara Murad, expert in policy.
Thank you so much, Nadine, and thank you all for joining us today. So today in our panel, we're going to discuss the concept of climate change and health, but from different perspectives. We're going to examine that from the scientific perspective with Dr. Khomsi, who's joining us today from Morocco to talk more about climate change and air pollution specifically and its relation to health. Mrs. Lina, who's going to shed light more on the gendered aspect of the impact of climate change on health. Ms. Yara, who's going to talk about the policy aspect of climate change and health. And Dr. Doumet is going to reflect overall on the impact of climate change on health systems and healthcare organizations from her experience and through her interaction with the panelists as well. So we're going to start with Dr. Khomsi. Dr. Kenza is an expert in climate, air quality, and environmental health with extensive experience in climatology and air quality. Her work explores the intersection of air quality, climate change, and the human health, advancing research in urban heat islands, air quality monitoring, and the impacts of climate variability. Her international collaborations with organizations such as the World Meteorological Organization, World Health Organization, and the Climate and Clean Air Coalition have positioned her as an advisor on key environmental and public health issues. Her widely published research addresses topics including air pollution, climate change, and the role of science and policymaking. Thank you so much, Dr. Kenza, for joining us today, again from Morocco, and you'll be able to, give us your perspective on the regional impact of climate change on health. My first question to you is based on your experience and research in the field of climate health, climate change, and with particular focus on air pollution. What are the most pressing climate-related risks affecting human health in MENA, and how does air pollution specifically, as a consequence of climate change, compound these health challenges?
Yeah, thank you so much, Noor. Hello, everybody. Good afternoon. Thank you so much, Noor, for the introduction. And first and foremost, I want to congratulate GHI and AUB for owning this program. The Cli-Health program is what is coming at the appropriate moment. It is very needed in the region. So congratulations for that. And I want to congratulate you twice and even more because you challenged the situation and you were able to launch this event today. So I'm very proud and humbled to be part of this program, and I'm very pleased to join you today. Also, Noor, thank you so much for asking the question, and it is an enlightening question, having lots of components. And before moving further in answering the question, I really want that we stop all together with acknowledging the urgency and the emergency that is coming with climate change. So climate change is increasingly recognized as a paramount health challenge, particularly in vulnerable regions such as the Middle East and North Africa region. And indeed, the impacts of climate change are multifaceted. So we can say literally that it affects everything, going from air quality to the water scarcity. And nowadays, science is telling us, pay attention. There is a link between climate change and impact on health. And there is a link between climate change and mortality. And if the human is keeping in its emissions trajectory as they are, this will impact its health his health directly. So I always like to sound the alarm that this is not a joke. There is a huge link between climate change and health. Now, taking the first component of your question, Noor, and it is about the health risks related to climate change. And I always like to talk about this according to 3 corridors. And I like to name them corridors because they are very long, limited, and they need a lot of work. And these 3 corridors are heat waves and extreme temperatures, water scarcity and food security, and also vector-borne diseases. So in our region, when we talk about extreme temperatures and heat waves, this is something which is very important because our MENA region is warming faster than the global average, which means that our region is warming more than a lot of other regions around us in the world. And indeed, the temperatures are projected to rise up to 4 degrees C by the end of the century. And this will increase, of course, the risk of health illnesses that are related to heat. And this increase is particularly dangerous for vulnerable population that are mainly elderly and outdoor workers who are more vulnerable and exposed to heat stress. And studies have shown that heat stress leads to higher hospitalization rate, especially from cardiovascular and respiratory issues. Another thing is that to mention is that in the urban areas, the risk is highly important because there is what we call the urban heat island effect that further amplifies temperature, making heat waves more intense, more dangerous. And again, the vulnerable population are the elderly and the outdoor laborers and workers. The second corridor is water scarcity and food security. And our region is highly dependent on agriculture, and our agriculture is 70% rain-fed. And today, with the climate change-driven drought and water scarcity, agriculture is very threatened, and then food production, and then food security. This would lead to malnutrition. This can increase also the spread of waterborne diseases, and also the lack of water or the lack of access to clean water would create problems with sanitation, contributing to the spread of infectious diseases. And here, the third corridor is the vector-borne diseases. And in fact, climate shifts are changing the geological spread of diseases. For example, malaria, dengue, or even leishmaniasis, these are transmitted by mosquitoes. And indeed, this will increase the prevalence of these diseases in places where we are not used to see these diseases before. So 3 main impacts that are related to heat, that are related to water and food, and that are related to vector-borne diseases. We can link them to climate change in our region. The second part of your question, Nor, is about the air pollution and its compounding impacts. And you are right to say that air pollution can be a consequence of climate change, and it is intensified by climate change because climate change can cause the increase of ground level ozone concentrations, and also can be behind the rise of the PM particulate matter, PM concentrations in the air because of dust storms, and this has direct effects on the respiratory health of the human, and this can cause asthma and other respiratory diseases. So talking then about dust and sandstorms as a phenomena that increase the concentration of particulate matter in the air. So our region is highly exposed to sand and dust storms, and here I will give some numbers. So, for example, and this is according to the last report about this that was issued by the World Bank. So it is said that, and the report came in 2019, and it says that in Kuwait, for example, dust storms led to 8.4% increase in daily emergency asthma admissions over a period of 5 years. And this was clear mainly among children. And also in Qatar, asthma cases are reported to increase by 30% when we have windy conditions, and also with the dust storm, the very dangerous dust storm that happened in 2005. So we had 1,000 cases of suffocation. So the figures are really threatening and also alarming. So this is with dust storms. Another phenomena which may be not very dangerous as the dust storms, but it is there. It is the wildfires, and as long as we will be exposed to increased temperatures and prolonged dry seasons. So this is threatening the rise of the frequency of wildfires. And with wildfires, we have harmful pollutants, mainly black carbon. And today we are talking a lot about black carbon worldwide, even though it is not very well handled or scientifically managed and known as our region, but this is something that is coming also with the climate change. So indeed, the health risks from climate change and air pollution are not evenly distributed, and this is what the program wanted to tackle. And we have vulnerable populations, including low-income groups and those in conflict zones that face disproportionate burden. And in fact, addressing this requires really the consideration of health within the different policies within the region.
Thank you, Dr. Kenza. And I want to add to what you said, the conflict, right? So the conflict that we are witnessing in Lebanon itself, it's contributing to air pollution, and this by its turn is contributing to a huge impact on health as well. So thank you so much. You highlighted the heat waves and how they impact elderly and outdoor workers more than others. You also highlighted extreme temperatures, vector-borne diseases, food security, and water scarcity. But I'd like to stop on the aspect of how heat waves impact elderly and outdoor workers more than others, and to move to Ms. Lina Abu Habib to highlight this aspect. So just before continuing the discussion with Ms. Lina, I'd like to introduce her. Lina is the director of the Asfari Institute for Civil Society and Citizenship at the American University of Beirut. She is also the gender director of the AUB MEPI TLS program and teaches undergraduate and graduate gender courses. Lina is a feminist activist and researcher with a long career working with local, regional, and international institutions on gender mainstreaming and feminist activism. She has designed, implemented, and led multi-year gender equality initiatives, including training, research, and community actions. And I'm sure Lina is very happy that we are a panel of women all here today. So, Lina, to move to addressing the aspect of climate change and health from a gender and social justice perspective. We always say that climate change disproportionately affects vulnerable populations, particularly women and marginalized communities, but also others in some aspects like heat waves, such as what Dr. Kenza said. So can you elaborate on how it affects them disproportionately?
Absolutely. Thank you, Noor. First, I want to say it's a pleasure to be working with you and Shadi and all the wonderful colleagues at GHI. And maybe begin by saying, yes, Shadi mentioned that it's a sweet moment, and I couldn't agree more. But it's also a very timely moment, because what we are experiencing right now, whether the war in Lebanon, in Palestine, the dramatic natural disasters that happened in Morocco, in Libya, and other parts of the world, everything seems to concur to say that this is a timely intervention. And I'm very grateful to GHI for always being the avant-garde in addressing serious issues, timely issues, and in a way that is intersectional. And that's where I want to, how I want to answer your question. Zainab said when she was introducing the program, she talked about pre-existing conditions. And I think that's my starting point, that inequalities are not caused by a shock, a longitudinal shock like climate change. Inequalities pre-exist, they have always been there. But when you have the impact of something as violent as climate change, and when you have climate injustice, then what it does is that it exacerbates already existing vulnerabilities. And that's why this program is important. I will look only at two kind of what we call gendered vulnerabilities, just to unpack a little bit how they are impacted by climate change. And also to end by saying, okay, so what are, so how do we address, this? Before we have any visible impact of climate change, before we have a war, before we have anything, in a regular situation, women and girls experience the overwhelming majority of the care burden, the burden of care work. And by care, I mean caring for their families, caring for their communities, caring for everything around them, including caring for the environment around them. And I want to give an example now. The presence of internally displaced people in Lebanon right now is very visible. And of course, one is tempted to say that displacement affect people in the same way. Actually, to the visible, even to the naked eye, you walk around and you can see displaced women doing work in makeshift tents on the streets, etc. And I hate to say this, but men sitting around and watching time. So care has not been redistributed by displacement. It has been exacerbated by the displacement. So that inequality in the distribution of care work is further exacerbated by climate justice. So, for instance, climate change causes makes the search of livelihood longer, be it water, be it food, be it securing the healthcare of your family. Climate change breaks down the system and makes these important daily tasks much longer with the absence of any system. This actually means increasing the time burden on women and girls rather than anybody else. So already there is more pressure for women and girls to do what they were doing before, but with less resources and with more stress and with more responsibilities. One of them is actually mitigating the health risks. Mitigating the health risk while they themselves have their own health conditions and health priorities to take care of, which are undermined in situation of dramatic climate change. I cite here sexual and reproductive health and care, menstrual health, etc., which become actually they're not a priority, plus they are taboo issues. And we have been hearing the horrifying stories of what young girls and what women do, because of course menstruation does not stop if there's if there's some a radical negative change in the environment around us. It just becomes more difficult to deal with. Climate change also, one of the impact of climate change is in causing additional economic strains and mental loads, which we do have evidence, not from this region granted, hence the importance of this project, actually increases the economic strain and mental burden on women. Climate change is also associated with displacement and forced displacement and migration. We do have data that shows that forced migration and displacement add on women's care work, women's stress, and mental strain, because these conditions are pre-existing. The second point I want to address also very quickly in terms of multiplying and amplifying gendered vulnerability is, of course, vulnerability to gender-based violence. And again, and that's why I'm very happy with this initiative, because it will allow us to gather data and testimonials to show the intimate link between climate change in this region and the increased gender-based violence caused by displacement, caused by the fact that mental change is linked to emerging unsafe living conditions, thus making the lives of women and girls unsafe and more prone to violence. Resources scarcity caused by climate change also puts women and girls in more vulnerable conditions, and we do use the term "quote unquote" transactional sex when it becomes a blackmailing chip for women and girls to be able to access resources that have been made rare by climate change. And of course, in this situation, so imagine a major like the earthquake that happened, and we do have anecdotal testimonies during the relief efforts, during right after the earthquake in Syria and Turkey. We do have anecdotal data and testimonials of sexual violence and sexual abuse while women and girls were being saved from under the rubble. So imagine. So I just wanted to take these two examples. Of course, one can talk more, and we will be talking more, I assume, later on about sexual and reproductive health and rights, and that's a very important link in this intersectional approach. But I want to finish by saying, okay, so how does an initiative like the one that GHI is leading, and it's really a privilege for us and a great pleasure to be partaking in it as Asfari Institute. The first part is the contributing the evidence and the data and the knowledge. We know that in our region, I'm not saying there isn't such evidence, but it's very rare and it's rarely localized. So actually the localization of research methodologies, the amplification of voices as qualitative data and stories of women and girls experiencing climate change and its impact is one major contribution that will be done. And then secondly, and I will stop here, what makes the initiative, what makes the project very important is that intervention at this level does not come with the assumption that we will be intervening to resolve something that has started today with the climate crisis. And this is actually absolutely wrong. We are intervening to address a pre-existing gendered inequality that has been amplified by climate justice. And this framing makes the whole difference in terms of what the project does. So one is actually the localized knowledge production that is really needed, timely, and new. And then secondly, the analysis of where do these problems come from, how have they been exacerbated, and the need to start our intervention before, not with the vision to address a newly emerging problem. Thank you so much. And again, I'm very happy that we are collaborating in this.
Thank you, Lena, and it's our pleasure to have the Asfari Institute as partner on this program. And indeed, it's what's interesting is that the Cli-Health program is going to be working on documenting the narratives of women and girls and their experiences when it comes to climate change and how it impacts their lives and their health particularly. So before giving the floor to Dr. Doumet, I just want to encourage all participants to engage with us in this discussion. This is not a mere presentation or a panel discussion. What we aim to do is to initiate, a regional discussion on climate change and health. So we would like to hear from you either in the chat box or in the Q&A box if you have any questions or any input on this discussion. Dr. Doumet, to you.
Thank you, Noor, and good afternoon, everyone. And after hearing from a climate change expert and from a gender and social expert perspective about climate change, we're very honored to hear from a policy or public policy perspective. And here I would like to introduce Ms. Yara Murad, who is the Assistant Director of the Issam Faris Institute for Public Policy and International Affairs at the American University of Beirut. Yara supervises various policy-oriented programs and research projects under several clusters, including sustainability and inclusive development, policy and politics, and international affairs. At the Institute, Yara is also the program manager of the Refugee Research and Policy Program, where she manages various research initiatives and collaborations on refugees issues in Lebanon and the Arab region, much of which have been translated into evidence-based public policy decision-making. Thank you, Yara, and we really appreciate your presence. My question to you is that given the MENA region's vulnerability to climate change, what policy measures are needed at the national and regional levels to mitigate its impact on health? And how can these policies be effectively implemented?
Thank you, Dr. Doumet, for this important question. I'd first like to start by thanking GHI for inviting me today and for congratulating them on the launch of this very promising and timely flagship program. And as a representative of IFI, we're very proud and excited to be partners in this initiative along with Asfari Institute as well. So back to your question. As was strongly highlighted by Dr. Khomsi, the MENA region is frequently cited as one of the most vulnerable to the impacts of climate change, where the region is warming nearly twice as fast as the global average. And currently, we have over 60% of the MENA population living in areas of high or even very high water stress compared to the global average of 35%. However, we often see that climate change takes a backseat to more immediate challenges such as conflict, economic instability, social unrest, which are often very much related to the climate change, as Noor has also highlighted. As a result, governments in the region remained largely unprepared to address this growing climate crisis. In fact, the poor and inadequate policies that sometimes even exacerbate these environmental problems even further. We're already seeing extreme weather events like heat waves, floods, along with declining air quality, food insecurity, water scarcity, factors that are exacerbating this existing public health challenge. And of course, it's the most vulnerable, those in the rural areas, the poor, women and children, as Ms. Salina Abu Habib highlighted as well, and the migrants and displaced who are feeling this impact the most. So what can we do? If we start with the national level, first, we need to focus more on strengthening the existing healthcare systems. This means investing in healthcare infrastructure that can withstand these climate-related pressures. Also, these healthcare systems must be integrated into national climate resilience strategies, ensuring that they can respond to both the sudden shocks and the longer-term shifts. We also need to invest in early warning signs and data-driven health surveillance systems. So it was mentioned, this issue of data in the region, and data is often very difficult to find and put a hand on. So to have these proper data-driven health surveillance systems is key to track disease patterns, to predict outbreaks, especially those that are exacerbated by climate change. And this would enable a faster and more efficient response to health crises. Next, we need to think about how we can encourage climate-smart urban planning. So many of the MENA's region cities are suffering from urban heat island effect. Temperatures in some cities are reaching very high temperatures. Green spaces are currently taking up less than even 1% of most of the MENA cities' total area. And this is by far less than what the WHO recommends. And to combat this, we need policies that promote the creation of green spaces, the use of heat-resistant building materials, those that improve waste management systems. And these actions will not only help mitigate the effect of heat, but they'll also help improve the air quality and reduce the health burden on urban population. And finally, we can talk about water and food security, which are absolutely essential and critical to public health. In a region as water scarce as the region we live in, we need to implement very precise and cutting-edge water conservation technologies and support sustainable agricultural practices. This would eventually help ensure a long-term access to clean water and food, which are fundamental to public health and which Dr. Kenza had very much highlighted in her talk as well. Now, if we move to the regional level and where cooperation here becomes very important and crucial. First, there's a very clear need to have cross-border health monitoring. So as we all know, climate change does not know or does not recognize national borders, especially when it comes to health risks. For example, the vector-borne diseases that were mentioned, like malaria, they spread due to rising temperatures. To tackle this, we need to really work on regional platforms where countries can share data and set up early warning sign systems for disease outbreaks. Second, we need joint water management policies that are very essential. And water is one of the most important and critical resources in the region, and we simply cannot afford to address it in isolation. And at the Institute here, we have a lot of project and work done on water to try to suggest or recommend certain regional frameworks that can ensure more water security. Lastly, there is the climate-driven migration, which is another critical issue that was also mentioned today. Droughts and extreme weather events are forcing people to move, and especially from rural areas. We thus need more coordinated responses to ensure that the displaced population also have access to healthcare services. In fact, in one of the Institute's recent studies in 2023, we contributed to a major UNESCO policy study on climate-induced internal displacement in the MENA region. And specifically there, we developed comprehensive recommendations for public policy making that focuses on climate change mitigation, adaptation, and protecting the vulnerable populations. Now, the big question really would be, how can we ensure that these policies are effectively implemented? First, we recommend that there would be a multi-sectoral collaboration, which is very essential. So climate change has many areas and affects many areas, as was also mentioned, health, agriculture, infrastructure, every aspect of the economy. So it's very vital that ministries of health, environment, agriculture, urban planning all work together. And this is what would ensure that climate resilience is built into policies across the different sectors, rather than being discussed in silos. At the Institute, we collaborated very closely with the Minister of Environment and the World Bank on a very crucial discussion paper that bridges the climate action with economic recovery. And this work was presented in the COP28 in Dubai to try to identify the key policies and plans to complement the government's economic and financial recovery agenda that if it sees life at some point, but while ensuring that there is long-term sustainability and sustainable development. Second, I'd like to highlight on the importance of public awareness and education. So people need to really understand the risks they face and what they can do to protect themselves. Public education campaigns can be a very powerful tool, especially in vulnerable communities. And these campaigns can cover topics about how to protect yourself, how to stay hydrated, of course, and how to reduce exposure to pollution. Lastly, I'd like to mention the importance of international support and funding. We cannot stress enough here that we're not alone in this. The international community also has a very important role to play. There are mechanisms like the Green Climate or the Loss and Damage Funds that can provide critical financial support to healthcare adaptation projects and other climate resilience initiatives, especially in regions where we face a lot of resource constraints. So maybe just to sum up my contribution here, at the national level, we need to strengthen the healthcare system. We need to build climate smart cities. We need to promote and adopt sustainable water and agricultural policies and practices. Regionally, we need to collaborate on health monitoring, water management, migration strategies. And of course, here it's very important to stress on addressing all these factors with special attention to gender vulnerability and gender inequality, as Lina had also very much highlighted in her intervention. So together, these measures, amongst others, of course, can help mitigate these health impacts of climate change and help to protect the most vulnerable in our societies. Thank you, Dr.
Thank you. Thank you very much, Yara, for your substantial input on this very important topic. And as our experts highlighted, climate change, as we have heard, has a huge impact on health. And it's very important to assess the resilience of healthcare organizations regionally and nationally to climate change in order to ensure a continued ability to provide care in the face of, as you all agreed, increasing environmental challenges. So as climate change accelerates, healthcare systems are exposed, as we have heard, to more frequent and intense natural disasters. Recently, what is happening in Lebanon, the fire that is happening in the Matan area, though it's not a natural, it's a man-made, but it is impacting our healthcare system. So these events can damage the infrastructure, disrupt the supply chain, and overwhelm the health services. For now, we expect all patients who have health respiratory problems to go to hospitals and overwhelm the surrounding hospitals. So this makes it essential, very essential for organizations to adapt and become more resilient. And when we speak about organizational or system resilience, we cannot but talk about improving the capacity of health workers, because organizations without health workers are empty systems. So we need to really improve the capacity of health workers to respond to climate-related disasters and events. Why? Because health professionals are the front liners during emergencies. So making their preparedness critical for effective response and recovery. Therefore, we need to have training programs that equip health workers with the skills needed to handle the health impacts of climate change, treating people physically, but we should not forget the mental aspect. Also, mental health in disaster is extremely important. And we need to prepare healthcare workers to in public health preparedness, disaster response, and the management of disease that may become more prevalent during changing climate. Like now we're expecting the vector-borne disease happening in Lebanon. So building this capacity means fostering collaboration. We cannot do all this without, as my colleague mentioned, without having collaboration across different sectors, including public health, emergency management, and environmental science. So we need to train people to work together as a team in order to have a coordinated response to climate-related health threats. Also, this collaboration will empower health professionals to advocate for policy changes that would promote climate resilience. Also, we have to remember that health sector must not only respond to climate impact, but also lead. We need to be also proactive. We need to advocate for system change that address the root cause of climate vulnerability. In the context of war like we are living now in Lebanon and in the region, assessing the resilience of healthcare organizations and the capacity of healthcare workers becomes even more critical as climate change exacerbates existing vulnerabilities in the conflict zone. So healthcare facilities, as we all know, in conflict-affected areas may be subject to direct attacks, as it is happening in Lebanon, or be rendered inoperable due to damaged infrastructure, as it happens to many hospitals in Lebanon, or because they may not be functioning because of lack of medical supplies or shortages of health workers. So it's in such situations, it's crucial to evaluate the resilience of these facilities in both physical and operational terms. And we need to make sure in our programs to ensure that health system can adapt to worsening environmental conditions, thus continue delivering care under pressure and provide services despite disruptions to power, water, or supply chains. So also we have to remember that health workers in war zones face enormous challenges, and their ability to respond to climate change related disaster is often hampered by the conflict itself. So they may have to provide care in unsafe, resource limited environments, all while addressing both immediate injuries from warfare like what is happening now, and or the slower moving health crisis triggered by climate change. For example, in the disrupted sanitation in displaced camps, like what is happening now, our displaced people are put in schools and the sanitation is not functioning well. We expect to have diseases like lice, scabies, and cholera, and it is happening. And with the change in the climate, we're expecting in the very near future respiratory infectious diseases. So health workers in these settings need to be equipped not only with clinical skills, but with the training to manage public health emergencies and deliver trauma-informed care and adapt to rapidly changing environment. So in conclusion, the intersection of war and climate change and health demands urgent attention and coordination action like this program that we're launching today to ensure that healthcare systems remain functional and that health workers are prepared to meet the growing challenges of a warming, conflict-ridden world. Thank you.
Thank you so much, Dr. Mirna and Yara, for this contribution on policy and health systems vis-a-vis climate change and health. We have several questions in the Q&A that I will try to go over as much as possible. First, it's not a question, it's a comment from Goza from Ethiopia, who's saying that moving forward with new initiatives despite the current challenges in Lebanon proves the solid commitment of GHI for the cause and the strong leadership of the institution, and that adding the social justice part and the discussion is very commendable. So thank you so much, Goza, and thank you for joining us on that. Leah Kai, the manager of UNDP's climate change projects at the Ministry of Environment, has shared a link to a publication on the vulnerability of healthcare facilities vis-a-vis disasters, including COVID and climate change. So thank you, Leah, for sharing this. We are aware of this document, and we are leveraging these existing documents and publications to shape the different initiatives under this Cli-Health program. Miriam Dagher asked how multi-sectoral collaboration will be implemented in this program. I wanted to highlight a key aspect that our Cli-Health program will be focusing on 3 levels, basically, on the healthcare systems, on the healthcare organizations, and on the communities. And to each of these, we will be partnering with different institutions, organizations, from the public sector, from the private sector, from the NGO sector as well. We have our existing partnerships with the Ministry of Public Health in Lebanon and other ministries of public health in the MENA region. We also have our NGO initiative that has a large network of NGOs in the MENA region, which we are gonna, leverage and be proud of these partnerships that we established as part of NGOI to be able to work directly with community-based organizations and members of the community to better understand the narratives and the experiences. And we also have our partners when it comes to policy and the private sector to take this discussion to the other level. So thank you, Miriam, for this question. Dana Halwani from India Act raised the issue of the phosphorus and other prohibited weapons that are being used in the war. And this is very interesting and timely. And I want to tell Donna and everybody to stay tuned on our social media platforms because we have upcoming posts on the use of phosphorus and other weapons during wars and how this, affect human health and affect the whole, aspect of climate change, air pollution, and human health and access to health services. So stay tuned, Dana, to our upcoming posts on social media to have more insights on that. However, she also raised a question that I'd like to address to Yara and any other panelists would like to also answer this question is welcome. So Yara, we have a question from Donna that says, how can environmental consequences from using, phosphorus and other weapons during conflict and so be integrated into global climate policies?
Thank you, Noor. Thank you for this question. I think the answer would be beyond the answer I would give because I feel this is more of a political governmental sort of decision to be made in the country at hand. But at least let me say that it is a responsibility of institutions like us and academic institutions and research institutions to provide the research and data that you just mentioned to show the harm of using such materials such as phosphorus and others and the harm it causes and its repercussions, and then to inform and try to provide this data to the policymakers to impose such repercussions on those who use it. But I think this is honestly beyond me to answer. I think it's more of a political willingness and a political agreement to impose the utmost, if you want, punishment and repercussions on those using these materials at war.
Thank you, Yara. And I see that Lina will be answering our next question from Salam, who is suggesting that we should also be considering the child rights lens when talking about climate change and health. So, Lina?
Yes, I just wanted to reiterate that an intersectional approach is an approach that looks at different vulnerabilities and the ways in which these vulnerabilities are affected, especially when they occur with each other. So definitely, when we talk about gender differences, we're talking about not only women and girls, but we're talking about all women and girls across the gender spectrum. So that's absolutely a part of thinking with an intersectional lens about the impact of climate justice and climate change. There's a whole battery of issues that we think about. We think about forced marriages, child marriages. We think about forced labor. We think about a school dropout. We think about trafficking and sexual abuse. So yes, definitely, that is a part and parcel of thinking about the intersectional impact of climate change on categories of people, particularly when these categories overlap.
Thank you, Lina. The last question is from Noor Raush from the Hariri Foundation NGO, asking about trainings and capacity building material and resources that we offer at GHI to healthcare workers, that are at the forefront of providing services and support to those that are displaced. I want to encourage Noor and all participants to visit our online learning and development platform, GLAD, that includes a lot of online self-paced courses targeting different healthcare professionals, be it NGO workers, humanitarian health workers, health professionals, across different topics. So please visit GLAD, which our team will drop the website of GLAD on the chat box so you can access it and check different capacity building offerings on GLAD. Also, our team has dropped the website of the Cli-Health program on the chat box. Someone asked about it. So please feel free to visit our website and we will follow up with you through an email to share with you the link of the website as well. So I think this brings us to the conclusion of this event. But I want to tell everybody attending today that this is the start of this discussion and the beginning of a long dialogue among different actors across different sectors, not only in Lebanon, but also regionally. Stay tuned for upcoming events that we will be hosting and organizing at GHI along with partners on climate change and health, including webinars and other events as well. And we will keep you posted about the different updates related to this program. Please make sure to follow up our social media accounts to stay up to date on our news related to the Cli-Health program. And we look forward to engaging with you in the future events and occasions. Please stay safe, and thank you so much for joining us today.
Thank you.